I have spent more than 3 decades inside hospital emergency departments, and what I'm about to tell you could save your life. For individuals over the age of 60, a heart attack when you're alone is often a death sentence. This isn't an exaggeration, this is medical reality. Nearly half of all cardiac arrest fatalities occur before emergency personnel can even reach the victim. The reason? Delay, confusion, fear. Most seniors don't know the critical actions that can maintain circulation long enough for rescue teams to arrive. And here's the harsh reality. Without this knowledge, you could be dead within minutes. Day after day, I witness patients wheeled into our trauma bay who might still be alive if they had performed just one or two simple actions while waiting for help. They experience intense pressure across their chest, difficulty catching their breath, lightheadedness, clammy skin, and by the time our doors open for them, the vital treatment window has already closed. But there's hope. There are medically proven methods, straightforward techniques you can execute immediately, even when completely isolated, that can potentially double your chances of making it through. These aren't folk remedies or internet myths. These are legitimate protocols that heart specialists instruct their own patients to follow. In today's presentation, I'm going to share 7 essential strategies every older adult needs to understand to survive cardiac arrest when no one else is present. These are the exact procedures I wish every single patient who came through my emergency department had known before their crisis began. And when you reach tip number 3, prepare to be amazed. Medical research demonstrates it can be the deciding factor between irreversible cardiac damage and leaving the hospital on your own 2 feet. The majority of people remain completely unaware of this information, but after watching this, you'll be fully prepared. All medical citations and research papers I reference throughout this presentation are available in the description section below. Before we begin, let me ask you something. What is your current age? Share it in the comment section. I make it a point to personally read and respond to each comment as though we're having a face-to-face consultation in my office. So please, be honest and open. Now, without any more delays, let's jump straight into number 7 on our countdown. This is the initial action that could determine whether you survive or not. Number 7. Contact emergency medical services without delay. Never try to wait it out. The absolute first and most crucial step when you begin experiencing heart attack warning signs is simple. Contact emergency medical services right away. Don't hesitate. Don't question yourself. Don't think, this might just be heartburn, or perhaps it'll go away on its own. With every passing minute you delay, the destruction to your cardiac tissue becomes more severe. Heart doctors put it in plain language. Time equals heart muscle. The longer blood supply remains obstructed, the more cardiac cells perish, and the lower your probability of surviving becomes. Medical evidence supports this completely. Data from the American Heart Association indicates that individuals who contact emergency services during the initial 5 to 10 minutes after symptom onset have survival rates up to 50% higher than those who procrastinate. Yet, sadly, numerous seniors minimize what they're feeling. Scientific studies reveal that almost 1/3 of people aged 60 and above wait longer than 2 hours before requesting medical assistance, frequently because they don't want to create trouble for others or believe they can endure it. This delay can prove fatal. Consider this scenario. A 68-year-old grandfather living in Ohio experienced unusual tightness in his chest one night. He convinced himself it was probably gas, consumed some water, and sat down to rest. He waited for hours, hoping the sensation would disappear. When his daughter eventually discovered him and dialed 911, the cardiac damage was beyond repair. Medical professionals told the family that had he contacted emergency services immediately, he could have survived with minimal heart injury. This exact situation occurs thousands of times annually, and it's entirely preventable. Therefore, if you're over 60 and ever experience crushing chest tightness, sudden breathing difficulty, unexplained neeziness, or that unsettling cold perspiration, treat it as a heart attack until medical professionals tell you otherwise. Pick up your telephone and dial emergency services without any hesitation. Even if it ends up being indigestion, you've sacrificed nothing. But if it truly is a cardiac event, and frequently it is, you've just completed the single most vital action to preserve your life. Understanding the urgency in making that telephone call represents the first act of survival. But during the time you're waiting for emergency responders to reach you, what you do immediately afterward can maintain your blood circulation and purchase you additional critical minutes. This brings us to strategy number 6, a method proven to sustain oxygen delivery when every moment matters. Number 6, chew an aspirin tablet if you have one available and no allergy exists. After you've contacted emergency medical services, your next action could separate life from death. Chew an aspirin tablet. Not swallow, chew it. Why this specific method? Because aspirin isn't merely a medication for pain. It's one of the most effective clot-dissolving medications available without a doctor's prescription. Cardiac arrests occur when a blockage prevents blood from reaching heart muscle. Aspirin functions by reducing blood thickness and preventing the blockage from expanding, maintaining some circulation until professional help arrives. The scientific evidence is undeniable. A groundbreaking research paper published in the Lancet medical journal discovered that consuming aspirin during cardiac arrest decreased death risk by 23% in affected patients. But here's the critical detail. Timing is everything. The rapidly it enters your circulation, the sooner it begins working. Swallowing an entire aspirin tablet can require 10 to 12 minutes for stomach breakdown. Chewing it creates immediate breakdown, permitting the active compound to absorb through oral tissues and stomach walls within mere minutes. In circumstances where every second matters, those minutes can preserve heart tissue and save your existence. One former bus driver, age 70, was isolated in his living room when he experienced that crushing chest tightness. He recalled his physician's guidance, located the aspirin in his medicine cabinet, and chewed it while contacting 911. Emergency medical technicians later told him that this simple action maintained his circulation just enough to avoid major cardiac destruction. He left the hospital 2 weeks afterward, alive and maintaining his independence. But here's where most seniors make mistakes. They either don't maintain aspirin in their house, or they delay because they're unsure if it's appropriate. If you possess an aspirin sensitivity, a bleeding condition, or if your doctor has explicitly instructed you to avoid it, then omit this procedure. For everyone else, maintaining a container of regular aspirin in an accessible location is one of the wisest emergency preparations possible. Physicians typically recommend one complete 325 milligram tablet, chewed at the initial indication of cardiac arrest. Consider it this way. Chewing that single pill is like deploying a rescue operation to delay the catastrophe until reinforcements can arrive. It doesn't eliminate the heart attack, but it can prevent the destruction from becoming catastrophic. Moving quickly with aspirin maintains the probability in your favor. But surviving cardiac arrest alone isn't solely about what medication you consume. It's also about how you position your physical body during those frightening minutes. Number 5. Release restrictive garments and maintain an upright seated position. This decreases cardiac strain. When cardiac arrest occurs, every physical motion you perform influences how much pressure your heart must handle. One of the most straightforward yet most frequently ignored survival tactics is to release restrictive garments and maintain an upright seated position. Older adults frequently underestimate how rapidly constricted circulation and incorrect posture can worsen an already dangerous situation. Restrictive belts, elastic waistbands, or tight neckwear compress blood vessels and create additional difficulty for your body to distribute oxygen-enriched blood when it's most desperately needed. Maintaining an upright seated position relieves compression on the breathing muscle and respiratory organs, making inhalation easier and decreasing the workload on your already compromised heart. This isn't simply logical thinking. It's supported by human physiology. During cardiac arrest, your heart desperately attempts to circulate oxygen through constricted or obstructed arteries. Reclining horizontally forces the heart to function harder, particularly in seniors with compromised lungs or existing conditions like chronic obstructive pulmonary disease. By maintaining an upright seated position, ideally at a moderate angle with back support, you enhance airflow into respiratory organs, reduce compression inside the thoracic cavity, and permit blood to circulate more efficiently. A medical analysis in the European Heart Journal highlighted that positioning cardiac distress patients upright assists in decreasing pulmonary fluid accumulation, essentially the fluid buildup in respiratory organs that creates a suffocation sensation. In other words, your body positioning can literally determine the difference between gasping desperately for air and maintaining sufficient calmness to survive until professional assistance arrives. One 74-year-old woman in Florida experienced chest tightness while working in her garden. Rather than lying down in alarm, she relocated to a chair, released her gardening belt and elastic waistband, and maintained an upright seated position while awaiting the ambulance. Her cardiologist subsequently informed her that this decision likely prevented her from losing consciousness and collapsing before emergency personnel could administer oxygen. That minor adjustment prevented her heart from collapsing under excessive pressure. It's an action so elementary that numerous seniors disregard it, but it's critically important. If you experience those characteristic indicators like pressure, breathing difficulty, or cold perspiration, maintain an upright seated position, relax your shoulder muscles, and free your chest and waist from any constriction. Consider it as providing your heart adequate space to function. This adjustment purchases you valuable stability. But to additionally enhance your probability of survival, you need to maintain blood circulation to the brain and cardiac muscle when your circulatory system is under assault. This introduces us to strategy number 4, a powerful physical technique seniors can execute during those desperate minutes before medical professionals arrive. Number 4, cough forcefully if you experience lightheadedness. This maintains brain blood flow temporarily. It sounds unusual, almost overly simplistic, but during the middle of cardiac arrest, coughing, yes, deliberate coughing, can occasionally maintain your survival long enough for assistance to reach you. Medical professionals refer to it as cough cardiopulmonary resuscitation. The mechanism is uncomplicated. When you cough deeply and powerfully, your chest muscles contract forcefully, your breathing muscle compresses, and pressure accumulates inside your thoracic cavity. This pressure forces blood outward from the heart and toward the brain, maintaining your consciousness when circulation is deteriorating. Now, let's be absolutely transparent. Cough CPR isn't a substitute for professional medical intervention, and it doesn't cure cardiac arrest, but it can purchase you valuable seconds if you experience faintness, lightheadedness, or feel like you're about to lose consciousness before emergency personnel arrive. Medical research published in the Journal of the American College of Cardiology demonstrated that repeated forceful coughing during cardiac rhythm disturbances maintained patient consciousness and temporarily sustained blood pressure until emergency intervention could be administered. In certain cases, patients remained alert for multiple minutes simply by coughing every 2 to 3 seconds. Imagine this situation. A 69-year-old retired mechanic in Texas experienced a sudden wave of lightheadedness during what proved to be a massive cardiac arrest. Isolated in his workshop, he remembered learning about cough CPR. He began coughing powerfully, repeatedly, and remained conscious until emergency personnel arrived. Medical professionals later stated those coughs likely prevented him from collapsing and experiencing brain injury before they could restart his cardiac function. The science is straightforward. Losing consciousness during cardiac arrest results from a sudden decrease in circulation to the brain. By coughing forcefully, you generate artificial cardiac contractions, almost like manually squeezing a circulation pump with your chest muscles. It's not flawless, and it won't terminate the attack, but it maintains oxygen delivery to the brain long enough for professional help to assume control. If you ever experience your vision constricting, your head spinning, or your body becoming weak during chest discomfort, attempt this. Inhale deeply, then cough forcefully and powerfully, as though you're attempting to expel something from your respiratory passages. Repeat every 2 to 3 seconds until the lightheadedness subsides or emergency personnel arrive. Consider it as manually maintaining your cardiac motion when it's struggling. This unconventional but powerful method has preserved lives. But once you've stabilized your condition, you also need to ensure oxygen is entering your respiratory system effectively. That's where strategy number 3 arrives, another elementary but life-preserving habit every senior should perfect. Before we continue forward, if you're finding this presentation valuable, please tap that like button and ensure you subscribe and activate the notification bell so you never miss powerful health guidance like this. Number 3. Unlock your entry door and maintain your telephone within immediate reach so professional help can reach you rapidly. When cardiac arrest occurs, every second holds value, not only for your physical body, but for the professionals attempting to rescue you. One of the most frequently overlooked survival procedures is also among the elementary. Unlock your entry door and maintain your telephone within immediate reach. It sounds minor, but during a crisis situation, it can determine the difference between being discovered in time or being trapped behind a secure door while precious minutes vanish. Here's the reason this matters significantly. Emergency personnel are trained to force entry through doors if necessary, but every additional obstacle consumes time, and during cardiac arrest, time equals cardiac muscle. Research demonstrates that for every 10 minutes of treatment delay, survival probabilities decrease by approximately 10%. Imagine sacrificing those life-preserving minutes simply because assistance couldn't reach you rapidly enough. Unlocking your door beforehand eliminates that risk. A 73-year-old widower in Arizona learned this principle through tragic experience. He dialed 911 after experiencing severe chest discomfort, but collapsed on the floor before he could unlock his front entry door. Emergency personnel arrived within minutes, but had to waste precious time forcing their way inside his residence. By the time they reached him, excessive damage had occurred. Compare that with the experience of an 80-year-old woman in Florida who unlocked her door, gripped her telephone, and remained in a chair near the entryway. Emergency personnel gained entry immediately, initiated treatment, and transported her to the hospital. She survived with only minor cardiac damage. The second component of this strategy is equally critical. Always maintain your telephone nearby, particularly if you reside alone. Too many seniors leave their telephone in a different room or connected to a charging device out of reach. During cardiac arrest, even walking a few steps can trigger collapse. Having your telephone next to you ensures you can maintain connection with emergency operators until assistance arrives. Some even recommend activating your telephone speaker function so you can follow instructions without holding it against your ear. Consider it this way. Your telephone is your survival connection, and your unlocked door is the pathway that delivers help to you faster. Together, they eliminate obstacles and recover time you cannot afford to sacrifice. Once the pathway for assistance is clear, the next procedure is about maintaining your body calm enough to survive until that assistance arrives, and that's where strategy number 2 makes all the difference. Number 2, perform slow, deep breathing. This reduces cardiac stress and oxygenates your blood. During the middle of cardiac arrest, panic becomes your greatest adversary. When fear assumes control, your body transitions into survival mode, releasing a surge of stress chemicals like adrenaline. This elevates your cardiac rate, increases blood pressure, and forces your struggling heart to work even harder. That's why one of the most elementary survival actions you can perform is also among the most powerful. Perform slow, deep breathing. Deep breathing accomplishes 2 critical functions. First, it increases the quantity of oxygen reaching your blood and brain, which desperately need fuel when circulation is restricted. Second, it signals your nervous system to calm down, reducing the surge of stress chemicals that place additional pressure on the heart. Medical research published in the Journal of Cardiopulmonary Rehabilitation and Prevention discovered that slow, controlled breathing decreased cardiac rate and improved oxygen delivery even in patients with advanced cardiovascular illness. It's not a cure, but it provides your body a fighting opportunity while you await assistance. A 76-year-old retired nurse from Michigan described how she survived her cardiac arrest by focusing solely on her breathing. As the crushing tightness in her chest intensified, she resisted the impulse to panic. She maintained an upright seated position, closed her eyes, and began inhaling slowly through her nasal passages, exhaling even slower through her pursed lips. By the time emergency personnel arrived, she was weak but still conscious. Her heart specialist later told her that those steady breaths likely decreased the workload on her heart and maintained oxygen circulation to her brain long enough for treatment to commence. Here's the proper technique if you ever find yourself isolated and in danger. Place one hand on your abdomen, not your chest. Inhale deeply through your nasal passages, feeling your belly expand. Then exhale gently through pursed lips as though you're blowing through a narrow straw. Target about 6 to 8 breaths per minute, slow, controlled, and intentional. This type of diaphragmatic breathing not only helps the heart, but also maintains your mind concentrated when panic attempts to assume control. Consider each deep breath as purchasing yourself additional time. Time for oxygen to reach your brain, time for your heart to reduce its workload, and time for emergency personnel to arrive. And if there's one more habit that connects all these survival strategies together, it's the final and most critical one. The action at number 1 that medical research demonstrates can double your probability of survival. Number 1. Maintain maximum calmness and physical stillness. Movement can intensify damage during an attack. When cardiac arrest occurs, your initial instinct might be to move, to pace around, or even to attempt to walk it off. But that instinct can prove deadly. The number 1 survival principle is this: maintain maximum calmness and physical stillness. Every step, every sudden movement forces your weakened heart to circulate harder, and during cardiac arrest, your heart is already fighting for survival. By maintaining your body still and calm, you decrease the pressure, conserve oxygen, and provide yourself the optimal chance of surviving until assistance arrives. Science explains it transparently. During cardiac arrest, blood circulation through the coronary arteries is obstructed or severely diminished. Movement demands additional oxygen from the cardiac muscle, but with its supply eliminated, that extra demand only increases destruction. A medical study in the European Heart Journal discovered that minimizing physical exertion during acute coronary episodes decreased complications and enhanced outcomes. In straightforward terms, seniors who maintained calmness and stillness survived longer than those who moved around in panic. One 71-year-old farmer in Nebraska learned this directly. While repairing farm equipment, he experienced crushing tightness in his chest. His initial thought was to climb back up the ladder to retrieve his telephone. Instead, he forced himself to remain motionless and called for assistance from his current location. Emergency personnel later informed him that remaining still prevented his heart from collapsing under stress. He survived with considerably less damage than medical professionals anticipated. Calmness isn't solely physical, it's mental. Panicking floods your body with adrenaline, elevating blood pressure and worsening the attack. By concentrating on remaining still and practicing slow, deep breathing, you reduce that hormonal surge and assist in maintaining your body stable. Tell yourself, I've called for help, my only responsibility now is to remain still and breathe. This mindset prevents impulsive decisions like attempting to walk to the door or retrieve something across the room, actions that can trigger collapse before assistance arrives. Consider your heart during cardiac arrest like a fragile engine operating on minimal fuel. Every movement accelerates the engine faster and risks complete failure. Stillness, calmness, and conserving every fraction of energy is the key to purchasing time. This is the final, most powerful habit. Do less, breathe more, and permit help to reach you. Together, these 7 strategies form a survival blueprint, and while you cannot predict when cardiac arrest might occur, knowing exactly how to respond can be the difference between tragedy and survival. And there you have it, 7 life-preserving strategies every senior must understand to survive cardiac arrest alone. From contacting emergency medical services immediately to chewing aspirin, releasing restrictive garments, coughing when experiencing faintness, unlocking your door, performing slow breathing, and finally, maintaining complete calmness and stillness. Each action purchases you precious minutes, minutes that can determine the difference between life and death. Remember this fundamental truth. Cardiac arrest doesn't always provide you a second opportunity. But if you respond quickly, think clearly, and follow these procedures, you can survive and live to see another day. The scientific evidence is clear, but it only functions if you're prepared to respond. Now, I want to hear from you. Where are you watching from? And do you maintain aspirin or another emergency preparation ready in your residence? Share your answer below. We read and respond to every single comment because your experience matters and your survival strategies could assist someone else. Don't forget to like this presentation, share it with your loved ones, and subscribe for more life-preserving guidance. Stay safe, stay prepared, and remember, knowledge equals power, particularly after 60. If you have any questions or want to share your personal experience, don't hesitate to leave a comment below. We're always listening. Thanks for watching.